Mr. Payne. Thank you for joining me. Welcome to the Mad Lab.
Good morning. Pleasure. Thanks, Chris.
Yeah, thank you for joining me. I've been eager to really talk to you for quite some time. And I know that we've been in and out of each other's lives for the best part of 15 years since I came into contact with you. And now's the time to really get into the meat and potatoes of things.
Excellent.
So if you wouldn't mind, for the viewers, just go into a little bit of detail about your background and why you're here, and what it is that you do.
Yeah, thank you. Well, the background's very simple, really. My early life as a grown-up was in the furniture industry, and I was an agent for a well-known furniture company, traveling all around the country, and basically was suffering from lots of illnesses, mainly caused by stress and wrong diet, and the lifestyle wasn't conducive to good health, basically. So I gave that up slowly, trained as a herbalist and trained as an iridologist. And that led to me actually working as a lecturer for the herbal college that I learned all my basic herbal medicine from. And that also led to me going abroad to find out a lot more about iridology, which we can talk about later if you wish. And I realized that the iridology courses in this country weren't good enough. They were quite lightweight. So I went around the world, 3 or 4 different countries, to learn from really, really good people. America, southern Spain, Singapore, and actually wrote my own iridology course following that, which was taken up by the College of Herbs and Natural Healing, and they took me on board as a lecturer for herbal medicine and iridology. And it's sort of gone on from there, really, mostly seeing patients, but lecturing for various organisations here in the Midlands, Hinkley College, and places like, can't remember, so many of them. Eden Project in Cornwall, done a lot of work with them in the past. The Association of Holistic Therapists, done a lot of work for them. And various colleges around the country, in fact, around the world. A lot of work in Singapore with Chinese doctors. It's been a little bit of a interesting journey. These days, I see patients in the Midlands here, in Lichfield mainly, and a lot of work in Glastonbury, where there's an awful lot of interest in alternative and natural healing methods. And my project at the moment is to carry on seeing patients, but I'm also in Glastonbury to start off with doing a series of herbal medicine and natural healing courses for lay people and for professionals. And I'm starting again later this year to teach iridology at professional level. So that's a brief history.
So before we go into that side of things, because that's a very deep and interesting topic, let's go back a little bit further, because I'm sure the viewers will be very interested in knowing a little bit about sort of your personal background and how you came into, what it is that you're doing now. Because,
Yes.
You've established yourself as, a very prominent, herbalist and iridologist. You've done some wonderful work in bringing those two, because they are separate, iridology and herbalism, and you've brought them together, which is, very unique. I don't think it had been done before, or at least if it had been done, it wasn't very good. And so you've taken things to a whole new level with respect to naturopathic healing. And so what I'm getting at is if we can go back a little bit further, how did you get into all of that? How did it all sort of come around for you?
Yeah, so yeah, but I'm happy to talk about that. But first of all, I should clarify what you said earlier. What I've done isn't me alone. There's an association of
Sure. Yeah.
there's an association of herbalists, uh, and we're all iridologists, and we all do Western herbal medicine plus other modalities.
Yeah.
Some people Ayurvedic herbs, some people do Chinese, but mostly it's Western herbs plus iridology. So it really isn't just me. People who are interested could go onto the website for the association of, I can't remember their name now, that's silly of me. Anyway, there's Association of Naturopathic Herbalists. We'll come back to it, yeah. And on their website, you can get information on probably 100 people who work as I do. And if they are a member of the Guild of Naturopathic Iridologists International, or if they've been taught by a lecturer for the Guild, then you've got a really efficient iridologist. But it's not just me. My background comes from working class background. We had a good childhood, and I started to notice at quite an early age that quite a lot of people around me, relatives, friends, were always ill. And some of them were dying at quite an early age. My own father died at 59. And this, it became apparent that some people hardly ever seemed to be ill. And they certainly were living to a good old age. And when I looked at it, I saw the differences in lifestyle. These differences were the cause of their illnesses or their well-being. And it's not a matter of living at the top of a mountain on lettuce leaves and fresh air. It's a matter of doing what is good for your constitution. So, having been basically made ill with my very lucrative career in the furniture industry, there was nothing wrong with the payments or the company cars. They were good, but it was actually killing me. And I decided to train as a herbalist. So I was doing both. I was working full-time and training as a herbalist. So that wasn't really working very well because I had to work. And so I became an agent for the furniture company, which meant that I could take time off as and when I needed it. So I was able to study the herbal medicine, later on the first iridology course, and it went on from there. That's the basic background.
Interesting. Yeah. So, I mean, because what I find is, what I find is that there are people within society who have a natural inkling to sort of this area of, healing people and becoming a doctor or just generally helping people. Was that something that was in you? Did you feel as though you were just naturally drawn to this side of, this side of things? Or was it just something that you fell into by accident? Or
I did. It's really strange. When I was about 9 or 10 years of age, I had a tin box with lots of simple medications in, ointments, creams, and bandages and plasters, band-aids and things. And if a friend fell over or whatever, I'd be there with the salves, the ointments, not really knowing what I was doing, but really enjoyed doing that. Although I never had the least aspiration to become a doctor. I think that came from my mother, really, who used to go to the doctor but never took the medication, and she lived until she was a fraction short of 93. So that took
that's probably a good thing, really, then, wasn't it? It was a good decision by her.
In her case, I mean, I'm not recommending that people go against their doctor's instructions at all. But in my mother's case, it did seem to rather work. And she had one or two sayings, like she'd say, well, doctors will tell you what's wrong, but they'll find something else wrong with you as well. So she was a little bit wary.
So she was a very wise woman then, by the sounds of it.
I think she was. She didn't push her wisdom onto other people, but I think she knew what was good for her. And she had a diet that obviously suited her, and a lifestyle which was, full of love and help for other people, and seemed to suit her very well. So I never had aspirations to become medically qualified. And then I grew up, got married, children came along, and any aspirations towards natural healing were put on hold, simple as that. But then when I realized that I couldn't possibly carry on in the corporate work, something had to be done. And of course, you can't switch it on. You have to work at it. Nothing comes easy in this way. And it took 5 or plus years to learn what I needed to learn and get qualified. Yeah. So that's the way I came into it. Seeing people in the family having different lifestyles and thriving or not thriving. And the divide was definite. There was no possible chance that it wasn't the lifestyle that was making people ill. And I'm not perfect now by means, but it's like a matter of helping people now. When a patient comes to see me, we do a consultation, we do the iridology, and I'm able to take the information from the patient, and with the iridology, I know what changes they should make should they choose to do so. There's no forcing people. You can't do that. I give people information and they can take it up or they leave it or whatever. Most people who take it up, have some herbal medicine, make some changes, they get a certain percentage of betterment with their health. It's all about tipping the balance in their favor, helping them to do that. I mean, many people...
Yeah, there's an element of personal responsibility. Well, it's not even an element. It is a personal responsibility.
Definitely.
I'm sure you'd agree to that, right? I mean, it's
100%. 100%. I mean, even if you go with the doctors, and that's fine, it's a valid choice, obviously, but you need to go through some of this naturopathic work, if you like, in order to be able to make the choice. Do I stick with the doctor? Do I go with the naturopath, the herbalist, whatever? Or do I maybe do a little bit of both? But you need to give yourself choice. But to get that choice, you need to get the information. And I mean, one of my great teachers, Dr. Richard Schultz, American herbalist of great renown, I mean, wonderful man, wonderful healer. And he used to say, and he really drove this into us, use simplicity, first of all, to find out the cause of your health challenge. Simple methods. Take responsibility for the change that you have to make, or the changes that you have to make. It's such a simple formula, because if you look for the solution closest to the truth of why you've got a skin condition or migraines or arthritic conditions, as the doctor would name them, it can be that easy just to change your diet, have a few herbs. It can just be that easy. Other people, of course, if you've had what the doctors would name as arthritic conditions for 40 years, you've got to work at it a little bit longer. But there will always be changes to make. We've got to realize that in most cases, we make our own health challenges. They're caused by our life.
Exactly. And we've been conditioned now. If you there's one question that I'm going to come to in a second. Yes, because I'm eager to learn to get your perspective on it. But so we've been socially conditioned now through marketing and everything else that health is incredibly complex, and it's only understood by a very small group of people who are much, much smarter than you or I.
Yes.
And that's simply not the case. It's not the case at all. Health is very, very simple, and anybody can understand it, because health is you. It's your body, it's your soul.
Exactly.
And only you can really know what's going on, not somebody else.
100%, 100%. The doctors will very efficiently make diagnoses and give drugs out. I mean, and sometimes they're necessary, especially short term. Sometimes they recommend operations and other procedures, which most people don't want to go through. I couldn't tell you how many times over the years I and people like me, colleagues, have saved people from having operations or got them off allopathic medicines. People do want this in many cases. Always we tell people, we trained, and we really should tell people that if you're going to come off your medicines that the doctors are giving you, then you should consult the doctor. This is very important. But it's a matter of giving them absolute choice, helping them to make the changes. The doctor I mentioned earlier, Dr. Richard Schultz, when we were students, all those more than 35 years ago, he would give us profiles of people with different medical conditions and give us their iris photographs and give us all the details we needed. And then he would say, what are you going to do for this person? And we would get in little groups and decide as students what we were going to do. And in almost every case, he would say, all this is good, but you've overcomplicated it. You don't need to go to these depths. You don't need every one of these herbs. You don't need every one of these changes. If you do this, that will happen. Therefore, you won't need to do the next stage. You can go on to this. It's like a flow, but it needn't be a complicated flow. So
it's simple. It can be drawn down to simple cause and effect as well.
Yeah,
it's taking notice of a little change here will change that, and this is being caused because of this small behavior here, or
well, it can be simple. We over the course of many years, in the early years, I heard several lecturers say it's almost like a bird that's migrating. They start off in England and they end up in Russia, and they don't only end up in Russia; they land in the same field in Russia year after year. Yeah. If they change course by even 1/10 of a degree, they don't land up in the same field, or even in Russia, they land up in a completely different area. And it's the same with healing. Yeah. Many, many times I've said to people, look, have a word with your doctor, because these drugs are actually causing all the symptoms that you're presenting to me. Just see if there's something else we can be doing here. Or I've said to people, actually, it's this food or this drink, or you really do need to cut down on that an awful lot. And they're that much better. People phone me up after a couple of weeks of taking herbal medicines and say, I didn't realize I could feel this good anymore. Okay, what have you done? Well, I've done everything that you said. I said, okay, that's fine. Now there's a little bit more you should be doing, or that's great, stick with what you're doing. I mean, it's not always that simple. Sometimes people, as I said earlier, they've had joint pain and inflammation for 40 years. It's not going to happen in a fortnight that they get an awful lot better, but the edge might be taken off the pain. The joints might be less stiff. Do you see what I mean? There's betterment.
Yeah.
There's betterment. Yeah. My own mother.
People don't realize just how simple it can be, because they find it hard to believe because of the conditioning. They find it so, if you just make this small, subtle change in lifestyle choice.
Sometimes it's that easy. You get someone with what the doctors name as depression, and sometimes they have a few cups of chamomile tea during the day. I'm not recommending that for everybody with depression, but they have a few cups of chamomile tea, they get a really good night's sleep, and they're 10% better in the morning. And you go on from there. It can be that simple. It need not be complicated. Sometimes it is, but it need not be complicated. And I can honestly tell you that at this time, with new input of patients, I'm busier than I've ever been. For whatever reason is out there. Yep.
Yeah, I mean, there's so many theories behind it all, right? But I'm pretty sure. I don't want to, like we said before off air, like we should be tread lightly in this area because of certain things. But I mean, it's to be expected, right, Alan? This kind of result in health, in people's health. It's to be expected because of what's gone on over the last 3 years. And
yes, it's not surprising. Mm. And of course, a lot of people are.
So you've seen then. So you've seen a is it a drastic increase in people's health issues, or?
It is an increase in new patients coming through, and it's a drastic increase in old patients coming through with new symptoms. There's a big increase in the way I'm treating people with stress and anxiety, that type of thing, and there's a definite increase in what the doctors call neuropathic problems, nerve problems, physical nerve problems, and there's a massive increase in tiredness. Massive. I can't understand it. I don't know why. There are common factors that we maybe shouldn't mention here, but there's a dramatic increase in people saying, I cannot get going in the day. I'm having ginseng and guarana and, brain boosting formulas, and I'm still tired. I cannot cope. I've had people say, I'm going to lose my job, and there is a common denominator running through this. Yeah.
Okay. Yeah. Say no more.
No, that. Yeah.
Yeah. It's Yep. Go ahead.
No, so that's where we are with it. And that's one reason why, busy as I am, I really am keen to get some lay persons mainly, but they could be for professionals, seminars, courses, workshops, whatever, in order that people will know more about herbal medicine, that they are allowed to buy, they can grow their own, they can pick them in the wild if it's legal to do so. And also to tell people a lot about more naturopathic techniques for simple things. I had bursitis, an inflammation in the joint of my thumb, a few weeks ago. I got rid of it in 3 days. Yeah, totally simple technique to do it. Totally simple.
Yeah.
With things I've got, well, one thing mainly that I've got in the kitchen, really easy compress to make, and in 3 days of leaving on a certain compress overnight, the bursitis had gone. The inflammation was completely gone. The pain was gone. The thumb was perfectly flexible again. I want people to know this type of thing.
Yeah.
I want them to have a choice if they want to go.
There's an increase. I'm pleased to say that there is an influx of new people becoming aware of this sort of lifestyle choice, because I don't want to use certain words. I'm going to call it lifestyle choices, because I don't think it's a word that's flagged on certain platforms. But
yeah,
there's an increase of people becoming aware of these lifestyle choices, which is fantastic. But there needs to be more, of course. And in order to break down that programming, the perception of this type of lifestyle choice, it's going to need lots of repetition. It's going to need lots of, as you say, like these courses which you're planning on doing. All crucial. Getting the word out to people is of critical importance. I was going to say something, and I've just completely forgot what it was. But yeah, I mean, it's just there's a real misnomer about it, and that is that naturopathic medicine and stuff, it doesn't work. It's pseudoscience and all this kind of talk, and these narratives that get pushed around,
well,
probably from special interests.
Yeah, I mean, to just clarify my knowledge about this, about the way people choose, I've actually been quite busy, or very busy, since day one when I finally qualified. There have always been people who don't want to, for whatever reason, they don't want to go to the doctor. That is from like over 30 years ago. I've known people who just won't go to the doctor. So it's not a new
Yeah.
thing. It's just getting more and more people who are saying, I worked last weekend, Thursday, Friday, Saturday, Sunday in Glastonbury, and I had several patients who said, I just can't even see a doctor. I feel I need to be face-to-face, and they just want to do a phone call. Well, that might be adequate. I don't know. They know how they're working, I'm sure. But it's not what a lot of people want. And even if they go to the doctor, one doctor told me that he got 6.25 minutes on average with each patient. And if one person took 8 minutes, someone else had to suffer from his time loss. So when people talk to people like me, they're with us for about 1.25 hours for the initial consultation. And I really can't do my job properly in less time. So I'm not sure how the doctors do it, but, I'm not a doctor.
Well, it's about, like, care is about, it should mean care, but it's being used, to sort of as a marketing term. This word care.
Well, the word
because there's no care involved in their actions.
Yeah. Well, the word physician originally comes from, I think, Greek. I'm not sure. It means healer. And as my teachers kept pushing into us all the time, you need to do the physical, the metaphysical, maybe even the spiritual. If you don't address at least the first two of those, you're not going to get near to the problem. I mean, a lot of all iridologists will do iridology to the nth degree in the physical terms, but very few of us these days do metaphysical iridology, which means that we can see through people's eyes, their personality and how they respond to different stresses in life, and a lot more. And again, to back that up, every herbalist will deal with herbs at a physical level, but there are a few of us in this country who deal with herbs at a metaphysical level, which means that we can address the etheric level of people's being, if you like. Very lovely part of healing to be able to do.
Because there's more part.
Sorry?
Go ahead. Sorry.
I can give many examples of people who have benefited greatly from herbs used at a metaphysical level. Even animals. We don't deal with animals without the assistance or the permission of a vet. But I remember a lady, patient of mine many years ago, came and said, my dog is having a terrible time. He was trapped in a kitchen fire, and we did rescue him, but he won't go near the house now, and the vet doesn't know what to do. And I treated this dog metaphysically with the backing of the vet, and the dog was fine. We took away the trauma in that way. Yeah, absolutely true story. And I used herbs metaphysically when I was first thinking about doing this. A lady who came and devastated. She was a patient of mine for other reasons, but her husband had been diagnosed with Alzheimer's, and she was devastated. This was the end of her life. And I gave her one metaphysical herb without telling her, and she came to see me for a follow-up consultation a month later. She was not only okay with it, she'd opened up the local branch of the Alzheimer's Association. So, you could do things to this depth on occasions. Yeah. You've got a sign behind you, never give up. Well, I've got a handful of herbs which help people to keep going. And you will put a small amount, very small amount, into whatever herbal formula they're having from it for maybe other reasons. People could come for a skin problem and they've got the herbal medicine, and we've just put maybe one drop of a metaphysical herb in. It's powerful stuff, and people don't realize it. Powerful stuff.
They definitely don't. Because when you say herbal medicine to somebody, to a layman, it's like, oh, you know,
Yeah,
what, oregano or something, or paprika and things like that. Like it's, no. It's much, much more than that. It's,
paprika is, if you like, a herb. It's a spice. Oregano's a herb, and they've got very specific reasons. Think of herbs as plant products, not Chinese herbs where they use things like seahorses and spider venom and things like that. I don't know, not against it, but I don't know quite how that works. But think of the herbs as plants. They can be leaves and roots and bark of some trees, that sort of thing. But think of herbs as strong vegetables, very strong vegetables in some case. Now, the herbs you buy from the high street or your local, even the local supermarket sell it, they tend to be powders or teas or tinctures. Tinctures are liquid herbs, and the instructions will tell you how many drops to take and how many times a day. Excuse me. I do use tinctures, but most of my herbs are what are called fluid extracts, and they are several times stronger than tinctures. They're initially a little bit more expensive, but actually they're pro rata, they come out cheaper because you use far less of them than you use tinctures. So a tincture or a fluid extract is just that, a fluid form of the herbal medicine. And I use single herbs sometimes, but mostly I use formulas. Maybe 3, 4, possibly as many as 5 herbs in one formula. And they're all, the way I work, they're all individually formulated because everyone is different. I share my students, iridology students, pictures on the computer of identical twin sisters. And you really can't tell them apart facially, but their eyes are slightly different. When I say eyes, it's the irises, the coloured part, that matters. And their eyes are slightly different. So they need different treatments, different herbs, different advice. Yeah? We're all different, even identical twin sisters, they're different. So I cannot...
No two irises are the same.
No two irises are the same. No. That's why they're used in security situations quite a lot, at the airports and that. Yeah. No, there's never two the same. And your right eye is different to the left, etc. And it's lots of differences. Those differences are very meaningful. Very meaningful. We could do...
So let's put this into a little bit of context before we dive a little bit deeper. Just so we're talking about then iridology, which a lot of people are not familiar with. So let's touch on what iridology is, and then we can talk a bit more broadly.
Okay. No, that's fine. If you want to, we could do a webinar on iridology and herbal medicine, and we could go into this.
Yeah, we could do a completely separate. Yeah, sure.
But iridology, if you look into yours or someone else's eyes, look at the coloured part in the centre. That's the iris. That coloured part it'll be grey or blue or certain shade of brown. It might have white areas. It might have some areas with large areas of pigmentation. And all of these signs and colours mean something to the iridologist. My eyes have a lot of what look like holes. They're called lacunas. They're very meaningful, but not everyone has them. They're not a sign of illness. They're a sign of lack of energy running through those areas, which could result in a health challenge if you do the wrong thing. Now,
so just to clear something up, because a lot of people would say, well, how can you determine someone's health by looking at their eye?
Well, there are many other signs. There are signs of pigmentation. There are different lines, different ring forms, and about 95% or more of these signs, they're not signs of good health or bad health. They're signs of that person's constitution. Most of them you have at birth or by the time you're 5 or 6 years of age. Some of them don't appear until, with some people, in their early 20s. But most people, by early childhood, they've got all the signs in their eyes which help an iridologist to determine that person's constitution. That's why I would know that this herb is good for that condition rather than this other herb is good. And different types of eyes have different needs, you see. The blue eyes,
Right.
in fact, and the grey eyes, they're called lymphatic eyes. Those people tend to have more problems with lymph system, kidneys, skin, and mucous membranes. The dark brown-eyed people have more problems to do with their liver, gallbladder, and the blue eyes and the brown eyes tend towards different, for instance, digestive problems. Now, we've all got these organs in our body, apart from specific male and female related organs, we've all got the same organs, but these are tendencies towards. So let's say, I'll give you an instance, a young man comes to me with a skin problem, let's say what the doctors call psoriasis. A blue-eyed person would need certain herbal formula and certain dietary advice more than a brown-eyed person who would want very different herbs and possibly very different advice in order to get the results we want. That's the simplicity of it. Yeah?
Right.
Okay, so then we add to that.
Yeah, go ahead.
Well, then we add to that different signs in the eyes. That's based on colour alone. When we look at different signs in the eyes, we can say, actually, this organ is under a little bit of stress. There's a little bit of acidity in this area. There's a little bit of pain and inflammation in this area. These are all things that can be seen. So you've got the basic constitution and you've got a lot of information about what's happening energetically, in the various organs. So if I see an energy need in the kidneys and the lymph system, and this guy has got psoriasis, I know exactly which road to take with this person. Can't be any other. That's the way it works. Yeah, that's the way it works.
And so for simplicity purposes, then you could say that this, whatever a person is experiencing, if whatever their health challenge is, it appears on the eye.
Well, you can see the eyes throw up the questions that the practitioner has to ask, because the eyes do not show illness. They are not diagnostic in the way a blood test or a liver function test is diagnostic. They're definitely not diagnostic in that way. It's an assessment technique. It's an assessment of the chi, energy, chi, ki, prana, whatever you want to say, in the body, the inherited energy, and what it's been doing. There are no good eyes or bad eyes. It's what you do with what you've got. If you've got blue-grey eyes with white plaques, which we would call uric acid eyes, and you're determined to have food which is full of uric acid, and your life is full of stress, which amplifies uric acid uptake, you're going to get uric acid-related problems. And that could be joint problems, maybe what the doctors call arthritis or gout, or it could be digestive problems, acidic reflux, that type of thing. Or if you're unlucky, it could be both. But if you're going to go against your constitution for long enough, you are going to get those problems unless you're very, very lucky indeed. Yeah, it's the way it works.
I see now. So the constitution then is sort of the makeup of the person, in a sense.
It's the basis. It's the basis. Yeah, it's the basis. I'd love to.
From there, then you establish then, like, sort of what areas to go into, or how they might react to certain things.
That's right. I saw a 8-year-old young lady on Saturday, I think it was, in Glastonbury, and I said to her mother, the problems are based in the diet, although I can give some herbal medicine to help, but you really should be advised that this person, this young lady, should never have dairy products. Never. Really bad. She got 2 signs and 1 possible sign that her body just didn't like dairy. And her mother agreed. She said she's always worse when she has anything with milk or cheese in it, and she's coughing and mucus sticks. And mother agreed. But, if I could see children at an early age, not too early, but, 6, 8 or whatever, you can plan out their constitution and tell them what would be really good for them and really probably bad for them for the rest of their life, because the constitution doesn't change that much. Doesn't change that much.
It's the genetic makeup of the person, isn't it?
The genetic makeup, exactly. I think we could clarify this whole subject by maybe, if you choose to do another podcast, and put some pictures up and of people's eyes.
Yeah, we will. Yeah, we'll make a whole one dedicated to that, and we'll go into it in great detail. Definitely, lots of pictures and everything else, because this is
it would be a great
to see this.
Yeah, we can do all that. Yeah. So that's the basic, really. People come to me, and people like me, and they have a consultation. They get their eyes read. I normally photograph people's eyes and show them on the computer, enlarged versions of their eyes, and we go through all the points that are really necessary. Maybe do some metaphysical work, and then I can urge them, please take responsibility. Even if you choose to have medicine from the doctor, that's fine, but take responsibility for different areas in your life, and then make the change. Not always all at once. You can make changes gradually. We don't want to give people too much work to do so that they give up, And a lot of people need minor changes to make a big difference. It's that migrating bird syndrome again, Change direction a little bit and you'll end up in a different place. And if you do it naturopathically with diet and herbs, you're not likely to end up in a worse place by any means. No, not by any means.
Also, I wish more people understood that, because it's like when you take the routes of, the normal, we'll call it the normal route.
Yeah.
It creates more problems along the way. Whereas if you just take the route that's less taken, we'll call it the route that's less taken, then the problems seem to fade away.
Yeah, you've got the choice. I mean, I always say to people, what you do today determines what you'll be like tomorrow. Will you be a little bit better, or will you be a little bit worse? Because it can't stand still. The only thing is change. That's the only constant is change.
The only constant, yeah.
Now, as I said earlier, I'm nowhere near perfect, but I'd sort of tip the balance in my favour and follow my constitution, have done for many years, and have a few pleasure foods, and but I'm not perfect, but seem to be getting on reasonably well. Still working, and hope to continue working. Yeah. There's just
you're having a lot of success with the patients that you've had as well.
I'd be happy for anyone, any doctor or any therapist or any patient, to look at any of my patient notes with the patient's permission or without identifying them, of course. I'd be very happy for them to read the results on absolutely any that I've got in my file. I really would. Yeah.
Yeah.
There's the odd one
without using the word cure. I mean, I know I just said the word, but without using it in the sentence.
Yeah.
What kind of success rate would you say that you have?
It varies enormously. Only doctors are allowed to cure. Therapists aren't allowed to cure. Neither are we allowed to claim to help with named medical conditions, such as psoriasis. So we have to be generic and say, well, yes, I can help to improve the condition of your skin. Now, everyone is different. If a person has an illness which they're dealing with at an early stage, and if they do as they're advised, we normally get quite quick results. I've had people phone me up after 2 weeks saying, I haven't had a migraine since I saw you. Do you see? But if someone is like a lady I can think of at the moment in Glastonbury who had hair loss, her hair was falling, well, we identified the type of hair loss, we identified the cause, and it didn't improve for, I would think, maybe getting on for 6 months. And I urged her to, this is hair growth. You know, it's not going to work quickly. I told her that from day one. 6 months or maybe a bit less later, she phoned me up for more medicine and said, it's getting better. It's getting better. Also, my nails are improving. Also, my energy. You know, I get people who come for, let us say, joint pain and inflammation, and I give them a balancing formula, and they phone me up a few weeks later or come for another consultation, a follow-up, and they say, I didn't tell you this, but it's gone away. I'm sleeping better. I've got more energy. My libido's better. But I didn't tell you, but it's gone away. Well, that's because we've given them advice which balances their constitution more. And the herbs which are sort of balancing. Many of my herbal formulas have got the code BAL on it. That's a balancing formula. And I expect results, and I expect people to say, I didn't tell you this, but it's gone away. Get that all the time. But as far as telling people, they all ask, how long will this take? And I say, I don't know. You've got to be honest about it. I don't know. The more you do, the better I plan this formula for you, then the better you will get on. It's as simple as that. I normally say, give me a ring a couple of weeks after receiving the medicine, before if you want to, and let me know how it's going on, and then we'll take it on to stage 2. You know, that's very often the way it works.
Yeah, there's I just is my wish, and you know, this is a portion of my channel now is dedicated to this kind of thing. So it's, you know, like I said to you before we started, my channel's all about the development of men. I'm focusing mainly on men because men are at a low point in society at the moment. Women are actually doing pretty well with respect to certain things. Obviously, there's you know, it fluctuates in different areas, but you know, I'm a man, so I'm going to help my fellow man. And help is an area obviously we need to focus on. And if more men understood this type of, you know, just personal responsibility, you know, changing lifestyle choices, there'd be a huge influx of, you know, just healthy, more positive, more energetic men, because there's just, you know, even down to things like testosterone. Men's testosterone levels have dropped drastically. Like it's ridiculously low. And testosterone is the life source of a man. If you take away testosterone, you have pretty much a limp, you know, low energy, low libido, no interest. You know, but if you give it a sudden spike, you know, all those attributes come back. I just, you know, it's worrying is what I'm trying to say. It's very, very worrying. And it comes down to, you know, simple lifestyle choices.
It does, but there are some choices that we don't have, really. We can't avoid. Well, they're not choices. We can't do. I mean, when you see what's around us with everything from the products, some of the products in our food, you know, some of the additives and things like that, makes you wonder why they're not completely banned. They're banned in some countries, not in others. You get things like toilet cleaners and all sorts of things like that, which are absolutely awful. You get things like, I mean, who knows? I mean, while I was in Glastonbury, we got these chemtrails going over. Who knows what they're doing? Who knows what we're breathing in from those? No one seems to want to tell us. You know, we don't know what's in the water. You got fluoride in the water. Well, I don't go near it, but, you know, I go pure water as I can. But what's the fluoride doing? We don't need it, as far as I know, apart from they say it's good for the teeth. Well, you want to brush with fluoride toothpaste, it's your choice, but it shouldn't be in the water for people who don't need it. What's it doing? There's all these things going on, and all the stress of the way we're being forced to live today. We had lockdowns. We don't know what's going to happen in the future. Caused an awful lot of problem, as far as I can see, an awful lot. You know, people have had various.
There's there's so many chemicals. So the chemical side of things is something that which is, it seems out of your control, but once you're aware of it, you can actually control it. Because I go to great lengths now to make sure that what comes into my body through, orally, or whether it's on my body that soaks through.
Yeah.
I go to great lengths now to make sure that, there's the harsher chemicals are pushed away. Because, and it's very easy to do, in fact, very easy to do.
Very easy at the level in your home or workplace, but it's not so easy when you're out in the street and looking at what's going on around you. I mean, I go to my local supermarket occasionally, and there are aisles there that I just don't walk down because there's going to be nothing that I'll put in my mouth. Nothing at all,
Yeah.
But I mean, it's really...
Yeah. When it makes you wonder, doesn't it, when you've got a supermarket with a healthy section or an organic section, it makes you think, well, what's the rest of it then?
No, well, I mean, in the last year, there's been an awful lot of new vegan, organic products on the shelves of the supermarkets. But when you turn over the box and look at the ingredients, they're not really so very good in a lot of cases. There's very few, if any, that I would ever buy, to be honest with you. Yeah. Well, you're talking about...
well, just because it says vegan on the front of it doesn't mean it's healthy.
Doesn't mean it's healthy at all. No, not at all. Not at all. Most vegans I know would never even bother to look at supermarket vegans' so-called food. It's vegan, but it's got other things in it that you don't really want. You were talking about testosterone. I mean, and asking earlier what I'm seeing a lot of. What I'm seeing a lot of, more than ever, are ladies who want to conceive and can't conceive. That's the last 2 years. And I'm seeing an awful lot of more intense hormonal imbalances in ladies and to some extent in men. Yeah. I mean, I've never been short of male customers, but it used to be, I should say patients really. It used to be maybe about 20-25% male, but these days it's closer to 50%. And one of the reasons for that is that I'm getting men recommended by their partners. And they have the lady has an appointment with me and they say, you really should see my boyfriend or my husband or whatever, and they're booking in, they're being encouraged to book in. So I reckon I'm close on 50-50 female and male clients. Yeah.
And when they say, oh, you should see my partner, the male partner, is that because of low testosterone specifically, or because...
No, not specifically. Not specifically. A big one is low libido, and men don't generally want to come and talk about that for obvious reasons. It's getting better. I've seen several men recently, because their wives are trying to conceive, and the hospitals, bless them, can't find any reason why they're not conceiving. And I'm finding that the reports from the hospital say the sperm count is low, or sperm aren't good quality, or the mobility is low. It all that type of thing. Sperm morphology, as they call it, is worse than ever. And you wonder why. Again, there is often, but not always, a common denominator to this. But mustn't go down that road.
Yes, there is.
I can see the links. It's impossible to not see the links, but I've got no figures to prove it. I'm not likely to get them. That's up to other people. Yeah. The other thing with men is stress. Absolutely stress. Often to do with tiredness and not coping with their job properly. As I said earlier, I think I might have said, one guy said to me recently, I'm going to lose my job. I can't do this anymore. I'm going to lose my job. Then he's lost his house. It's like very important to be healthy at that level. Yeah. So you get all of this stuff. And stress is the big one with most men at the moment. There are other things. We pick up on other things. We talk about.
Yeah, I was watching something the other day. But actually, to be fair, I've been I've been researching this intensely for quite some time. And it was, it was about men's testosterone levels, and the fertility rates in people is declining. Our population is actually declining globally, and and in around certain countries.
Yeah.
And there was a I don't know if you're familiar with Joe Rogan. Have you heard of him?
Yes, yeah, indeed, yeah. Seen one or two of his things, yeah.
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 Yeah, so I was watching one of his podcasts, and he had a very, very fascinating guest on who talks about the cause of all of what I've just mentioned.
Yeah.
And it's to do with microplastics. And this is an actual fact.
Okay.
This is not theory.
Okay.
This is a fact that microplastics, the introduction of plastics in the 50s or 60s,
Yeah.
there is a direct correlation between that introduction and the decline in fertility rate.
Right. Okay. That's interesting. Yeah. And how are we getting these plastics into the body, from water bottles and things like that?
From water.
Yeah.
Exactly. From water bottles. Well, yeah, from everything plastic. That, if you were to take a very in-depth blood sample, you'd find them. We've all got them. And it explains, the low fertility rates.
Yeah. So leaching plastic containers into water and household products like shampoos and toothpaste and things like that. Yeah.
Exactly. Yeah. And there was one other thing as well. Actually, I was because I'm putting a video together on how to increase your testosterone levels.
Yeah.
And what foods and lifestyle choices decrease it.
Yeah.
A high carb diet is a estrogen booster, apparently, and it decreases testosterone. Another thing is plastics, of course, like we just mentioned, but more specifically, it's the warm plastic. So if you drink from a warm plastic bottle, that liquid will contain, I forgot the name now, but it's an estrogenic chemical, which will, if the clue is in the name, it will raise your estrogen levels and decrease your testosterone.
It's like a pseudo-estrogen, isn't it? It's an artificial estrogen. Yeah.
Exactly, yes. Yeah, that's the word they used.
Well, it's all around us. It's in plastics everywhere. If you're using a plastic top table, you're getting a little bit of this type of, I suppose we might say, unhealthy estrogen, or not estrogen that's not very useful to us. I've read, I don't know if it's true, that you can get such an effect from the covers on glossy magazines, that type of thing. I'd have to investigate more on that. But I can understand this. I can understand this completely, yeah.
And all of these sound quite trivial, because you don't really think about them, and they're very small points, but they have a huge effect, a massive effect. Massive.
I mean, there are things which have been driving men's testosterone down, or at least not being helpful, since man ever went into a pub. Because if you most drinks in the pub, the beers are made from hops, and hops are estrogenic. There's estrogen in hops.
Yeah.
So if a guy chooses to have a lot of beer, not the odd pint of beer, but if a guy chooses to have a lot of beer, then we often find problems with libido and erectile dysfunctions and things like that. Yeah, because of this.
Yeah.
You've heard of the term probably brewer's droop. Well, that's the reason for it.
Yeah, I am.
Yeah. So moderation in that might be helpful. I remember one guy coming and saying, "I've got erectile dysfunction and nothing works." He tried everything, presumably Viagra and that. He was smoking like a lot of cigarettes a day, and he was drinking an awful lot of beer, and his lifestyle was not conducive to good health, let us say. And he said, "Just give me some herbal medicine that'll..." I said, "It doesn't work like that. Are you prepared to..."
Yeah.
With this and that, and he said, "Oh, well, not really."
That's the programming, right? That's
it. Yeah.
Give me the cure quickly. Give me something quick.
So I had to say to him, don't waste your money on herbal medicine. And don't give me a bad name by telling people it didn't work. That was in my mind, And it's like he needed to do his part, and then we were more likely to get the results he wanted. Yeah? So
personal responsibility.
We do these things to ourselves, yeah.
I mean, there's what I know. I'm conscious of the time because I know you're very busy. You've got places to go. But there's one more thing that I want to touch on quickly, and we can do a separate, because I know you can't go into too much detail just yet. So we can do a separate talk on it. Have you seen? I'd imagine you get quite an influx of mental health issues as well. Would that be right? People, depression, and anxiety, and all those words.
Yeah, it depends on the level. I don't get clinical depression where people really have to, that they wouldn't make it to the clinic. It's like, but I do get people who say, well, I'm feeling depressed, whatever that means to them, and a lot of stress and tension. And actually, this is a beautiful area for iridology. It normally tells me exactly where the person is with what's causing the tension. There are various signs which are 100% accurate. And then it will tell me what herbs they would need and what advice I should give them. But also it will tell me, it'll tell me how to take sort of, let's say, neuromuscular tension out, which is also causing headaches, which can also be causing high blood pressure. So you can do several things in one visit sometimes, yeah? They come to you because that they've got the tension, the nervous system is needy, but when you do the treatment, their blood pressure goes down and they feel more relaxed in their body. Yeah, so one simple thing like that can lead to a lot of other benefits in the body. Yeah, that's what I'm trying to say.
Yeah. So there was something that I mentioned before we started talking, and it was because I've been. So I'll give everyone some context. So a few months ago, I was doing some really deep thinking on sort of mental health, the mental health industry, and where it's leading, because there's more and more people are suffering from some kind of so-called mental illness these days, and it wasn't around. This wasn't around 60, 70 years ago. This was very unfamiliar. So I read quite a shocking statistic the other day. It was something like 62% of people aged 16 to 24 are experiencing symptoms of depression.
Wow.
Now I'm thinking, why is somebody that young depressed, or apparently depressed? So it got me thinking about all this thing, and the whole industry and I came to the conclusion that this can't be right. There's something not right here. No. So what I discovered is that the psychiatric industry, the mental health industry, what they will do is they will take normal human characteristics and then group them together and then create a label or a diagnosis, right? A disorder. Yeah. And then they will push it out onto social media and various other, ways of communicating with people. And now suddenly then, if you resonate with that characteristic, you've now got a disorder. You've got a mental health issue. Yeah. When actually it's just a natural, normal human characteristic. It's part of the human experience.
Exactly.
Is what I'm saying. Now, what I've been planning on doing is putting together a case and gaining evidence and everything else. And this morning, I've discovered that there's a man called Dr. James Davis. He's a PhD, psychiatry and all the rest of it. And he's done this very thing. He's done all the work that I was planning on doing. And it's on YouTube. And it's absolutely unbelievable what he talks about. I can't even put it into words. I was shocked. I don't know if you ever heard of the Diagnostic Statistical Manual of Mental Disorders, or the DSM for short. Have you ever heard of this?
I haven't. No.
Well, this is a manual that basically it's the Bible for psychiatry, right? Everybody in that area will use this book. Now, this book, to put it in simple terms, I'm conscious of the time, so I don't want to keep it too long.
Yeah.
And we'll do a separate video on this, but essentially this book, it's been confirmed by the people who created it, and it's not based on scientific evidence. It's based on a voting system, a consensus. So every single mental disorder or so-called mental disorder is not actually based in scientific biological evidence, empirical evidence. It's based on a consensus.
Goodness.
Now, that is shocking.
It is.
Can you believe that? So, and this is household mental illness, depression, anxiety, and all the rest of it. ADHD is another big one, very popular today for some reason.
Yeah.
This is not based in scientific evidence. This is based on a consensus of a very, very small group of people who create the manual.
Goodness me. Well, that's no...
So I just thought I'd mention that just to see if you ever heard of it before. Or
that doesn't seem to be useful, does it, really? I mean, my teachers used to say to me, I've got two main teachers, Dr. Richard Schultz and Jill Rosemary Davis, wonderful herbalists from Norfolk, and they used to say to me, don't name an illness. Don't do what the doctors do. Just treat the person with what they're presenting and what they do. And then you've got a flow, and you just got to keep that flow going. And they end up the other side of the treatment, hopefully very, very well indeed. But you haven't cured an illness. You haven't named an illness and got rid of it. And also they used to say to me, and they used to remind us regularly about this, the doctor will say you've got this, and most people will keep that illness in their mind and body until the doctor says they haven't got it. If you see what I'm saying? They feel they've got their diabetes or whatever until the doctor says they haven't got it anymore. Which is...
It becomes an identity, doesn't it? They wear it because of who they are.
Yeah. And if you hang on to an identity, that's a good word for this we're talking about. If you hang on to an identity, it'll stay. That's it. What happens in the mind happens exactly in the body. Yeah. Yeah. You know, every organ in your body.
I've got depression or I've got anxiety. You know, it's like you're wearing it as a badge of honor in many ways. It's like, this is who I am. When in actual fact,
it must become part of who you perceive yourself to be. And you can hear people in general conversations saying the same thing. How are you? Well, he says that I've got this, or the doctor says I've got to take that. And, you know, you hear it all the time. Any social gathering, you hear it all the time. But the idea really is to, you know, every organ in your body has an influence on a certain train of thought. This is a part of what I was talking about earlier, metaphysical iridology. The liver, for instance, is the organ in which anger, frustration, and to some extent with some people, depression is seated. The kidneys are the seat of life energy. That's a Chinese medicine concept, which is accurate. That's where your main chi is seated. But more than that, the kidney energy gives you the motivity to move forward. The kidney energy is to do with fears, but not fears of spiders or anything like that. Fears of moving forward. And people who can't move forward often need their kidney chi raising a little bit. Do you know what? That's so easy to do with medicine, herbal medicine. It's so easy. And organs like the spleen and the lungs and the lymph system, they all hold different energies which collate with the mental images you have. That's why the two...
I mean, I suppose that's why then when you feel a certain emotion, you can feel it here.
Point to it, yeah. You know, you feel grief in the chest, in the lungs, and to some extent the heart. Spleen energy, that little organ, the spleen, which isn't, I don't think it's that well known in the West. In the work I've done in Singapore tells me an awful lot more about the spleen than our doctors are trained to know. But it's mostly metaphysical stuff, not physical. That's why our doctors don't know about it. And, it's complicated. And people whose spleen energy is down throw off with all sorts of health challenges, usually minor, so they're not seeking illness for those illnesses per se. But when we deal with the spleen energy, they feel better in all sorts of ways. It's really strange. It's a complicated organ metaphysically, very simple physically, but complicated metaphysically. And this level of dealing with patients is so rewarding, both for the patients and for the practitioner. It's like
and it's
the energy of this organ, and a light goes on. This needs picking up a little bit, and it's good work to do at that level. It's lovely,
It goes because it's all linked, and so to link this to mental health, and specifically depression. A lot of people what they say they're experiencing as depression is in fact coming from the chemicals that are in this section of the body here.
Yeah. Well,
what's the longest nerve in the body, I believe, is from the head to the gut or something, or I don't know if that's
the vagus nerve, the 10th cranial nerve. Yeah, I think that's the longest. It's a long time ago since I did anatomy and physiology. Not sure about. I think that's the longest. But it's the 10th cranial nerve, the vagus nerve. Very, very important. And there's a ring form in the eye of just about every single person, which is visible, which tells me about the autonomic side of the nervous system, to which the vagus nerve tends to have, various links. Sometimes these links between organs and nerves are a bit tenuous. Sometimes they're very, very important indeed. Again, I can't say this often enough. The eyes will tell us what's going on in that area. I mean, you talk about mental illness. We mentioned the spleen. Well, if the spleen energy is down, then it is really easy to raise up. If the spleen energy is down, do you know that person, and this is accurate, that person will tend to overthink things, not in a minor way, in a major way. So if we turn the spleen energy up, maybe they overthink things just a little bit less and their depression gets a bit less. Now, I don't know if there's any doctors could ever agree with that, with what they've been taught, but it happens in that way. Conversely, if the spleen energy is too high, that can have physical problems with, strangely enough, the digestive system. The digestive system and the spleen are very closely linked in Chinese medicine, but it's not a physical link, it's a metaphysical link. So you see, all these things are to be sorted out. When you're with a patient at my level, you have to just keep peeling the layers off the onion and revealing the base cause. And when you've got that base cause, then you've got something to work on and to help the patient with. Yeah, absolutely.
Yeah, because the chemicals, the brain is a concoction of chemicals.
Yeah.
Right. So and all food is chemicals.
Yeah.
And the guts and everything else is chemicals. So it's all this stuff has an effect on how we think. Right, different chemicals in the body are going to have different reactions, and therefore cause different thoughts or whatever else.
It forces them. It doesn't give you a choice. It forces them. Forces these mental aberrations. And of course, again, being a little bit careful with words, some of the medical interventions that people have had over the last few years have chemicals in them that will pass the blood-brain barrier. And that barrier is what's protecting your brain, supposedly, against chemicals and other things. Yeah? You've got more parts of the brain that protect the brain than you have neurons. It's just a medical fact. And when you get these chemicals that pass the blood-brain barrier, I don't know, I'm not a scientist, I'm not a doctor, But I'm wondering if that is the cause of some of the tiredness and, I don't know, hormonal upsets with people. There's got to be a reason for all these things, this increase in things recently. Yeah. Food for thought.
Well, for sure.
Food for thought.
Food for thought, yeah. Listen, Alan, it's been absolutely fascinating to talk to you. And I could continue this conversation pretty much all afternoon, as I'm sure you could as well. But I know you're a busy man, you've got places to be. So I'll let you go.
Okay. Thank you.
So what we'll do is we will definitely pick this conversation up again when you've got some time. We'll talk, all the areas that we couldn't cover today.
I think that
we'll do that very soon.
What we've done today felt a little bit convoluted to me, and we're dodging here and there in different subjects. So I'd really like, if you agree, to do some specifics like herbal medicine and
of course,
different natural healing techniques, maybe give people a few hints, and iridology particularly. Let's see if we get any requests for that type of thing. I can do it at a very easy to understand level, Rhys.
Yeah, sure. Today we could call it an introduction to who you are, just talk generally. Now we can get into the real meat and potatoes of it all.
Excellent. That would be great. Thanks for asking me. Okay.
No, it's been a pleasure. And I think we need more people like yourself. We need more information like this out there. So, let's do our bit to push it out for sure.
That's all we can do. Yeah.
Okay.
Thanks a lot.
Right, Adam, let's speak soon.
Yes, indeed.
Take care, everybody.
Bye-bye.